The following program was produced by an independent community producer. The opinions expressed do not necessarily reflect those of the ECAT staff or board of directors.
Giving a voice to the voiceless, pulling stories out of the shadows and putting them under the spotlight, making sure that each person is valued and cared for. This is Humanity First with Peter Evers, presented by BAMSI.
Hi, everybody, and welcome to another edition of Humanity First. We took a week off last week because it was Thanksgiving, so I hope everybody enjoyed Turkey Day, and I certainly did, and it was nice to get a couple of days off. And I always take a moment to thank all of those people who work over the Thanksgiving weekend. Certainly at BAMSI, where I work, we have a full core of people who are providing services Thursday, Friday, Saturday, Sunday. So a huge debt of gratitude that we have. Those people who stayed at home and were able to be with their families. And I hope everybody enjoyed it. Speaking of families, we are going to do a couple of shows over the next 2 weeks about housing. Housing is a critical element in any society or culture. When we look back in history, it really was housing began with the end of the nomadic period, people who began to settle and adopt animals, as it were, and farmed. The beginning of that, of course, came with housing. And housing, I suppose, has been an issue and a problem ever since. And today and next week, actually, we're going to have John Yazwinski come to talk to us, who is the executive director of Father Bills and Mainspring. So that's a treat that we have in store for us. Right now, we're going to split these two conversations into sort of what has happened with housing and insecure housed people over the past few years. But post-COVID, we're going to be looking at some of the best practices that are coming up and some of the thoughts around how do you create more equitable housing for people in any given community. So I'm really looking forward to having that conversation with John. I grew up in a different culture. I grew up in Europe, and I grew up in England. And interestingly enough, my parents were Second World War babies and lived through the Blitz in Britain. I came from a place called Hull, which was bombed severely because we were a shipbuilding port. And I, as a child, witnessed homelessness on a very large scale, because after the war, even for 20 years after the war, housing stock was being rebuilt in England and people were living in prefab houses. And of course, those are people without means. Those are people with less means, should I say, people who are often struggling with poverty and other issues. And as we look at health outcomes in our culture and in European culture, we recognize that the social determinants of health are really the things that determine people's health. If you're not securely housed, you're much likely to have more health issues. You're much more likely to struggle in terms of your work history. And so everything really is attached to whether or not, as a child and as an adult, you have somewhere to call your home. Well, you have a roof over your head. And so many people in this country, so many people around the world do not have that privilege. They do not have the security of knowing that they can go somewhere of an evening and close the door and close the world out from them. And really, the World Health Organization do speak about housing being a right and not a privilege. And we're a long, long way away from that. And so I think over the next 15 minutes, as we speak with John, we'll get an idea of some of the reasons for that, some of the reasons for the inequities, and some of the things that his amazing organization have been able to do in and around Brockton over the past 20 to 30 years. So we'll be right back with John Yazwinski.
Hi, I'm Jamie. I'm an essential worker here at BAMSI, and I'm a nurse. Nurses are essential here at BAMSI because as nurses, we really have the opportunity to make an impact. We have very small ratios, so we have the opportunity to really learn everything about the person served and be able to give the best care. It really serves such a great purpose for me as being a nurse, and really why I came into nursing. Learn more about nursing opportunities at bamsijobs.org.
Giving a voice to the voiceless, pulling stories out of the shadows and putting them under the spotlight, making sure that each person is valued and cared for. This is is Humanity First with Peter Evers, presented by BAMSI.
Welcome back, everybody, to Humanity First. My name is Peter Evers, and I'm your host. And as promised in the opening monologue, we have John Yazwinski here from Father Bill's and Mainspring. John, thank you so much for coming on.
Oh, wonderful to be here. Thank you, Peter.
You know, I was thinking about this when I first came to BAMSI, which is a couple of years ago, 3 years ago. We did a podcast together on the radio.
Yes.
And we were right in the middle of COVID, I think, at that time. And believe it or not, this March is going to be 4 years since the world closed down. And I was talking to somebody about that the other day, and I said, do you think we'll ever get back to that situation again? And I don't think so. I don't think so, because I think we've worked out, sort of herd immunity. I think we've got a therapeutic, we've got a vaccine, and a lot more knowledge about that. But what an amazing few years this has been.
I mean, taking on a pandemic, right, where there wasn't a playbook,
Right.
and just seeing how the word pivot became all part of our vocabulary on a daily basis. And when you think about what we've just been through, absolutely right.
Yeah.
It was such a challenging time, but what a great time where, as hard as it was, seeing so many organizations that never worked together and seeing government and nonprofits and community come together is hopefully things that we've learned from and will continue to strengthen.
I hope so. And of course, this idea of the essential workforce, which is yet to be backed up, I think, by the contracts that we get in human services to make sure that we pay those essential people a living wage, and so that they can not worry about paying their rent or putting food on the table, which is, of course, why we're here today, to talk a little bit about perhaps the inequities that exist in our communities around people's the availability of housing, and what we're doing about that. So first of all, I think that most people that are listening probably have heard of Father Bill's and Mainspring. Can you just give us a thumbnail about where you're at? I know we've got a really great project that we'll talk about later, but a little bit about the history maybe of Father Bill's.
So Father Bill's and Mainspring, both, it was two organizations separately that started in the early 80s. And wherever you may have been living across the country at those times, you may have just started to see people. What we started to see in kind of the South Shore communities of Massachusetts, just across like the state, was people not just coming to our different interfaith groups and or civic groups and asking for help with food or clothing, but like visibly starting to see people sleeping outside.
Right.
And so both Father Bill's and Mainspring's history is they became organizations and or a mission in the early 80s, started to shelter families and individuals in basements of churches and Salvation Armies and different facilities. And through the years, sad to say, we're still needed to be here. And so Father Bill's and Mainspring merged in 2007. And so at any given night right now, we're going to shelter over 160 families.
Wow.
250 individuals throughout the greater Quincy, Brockton, Plymouth County, Plymouth area. And something that's really dear to my heart is, thankfully, we've also developed and either own or operate over 700 units of permanent supportive housing for our most disabled, vulnerable population.
Which is an extraordinary thing. I remember doing some work with Mass Coalition for the Homeless back in the early 90s. And I worked at Pine Street Inn, actually. And, that notion that we don't do shelter, we find permanent housing for people. And of course, all organizations end up doing shelter anyway, because that's what's in front of us, especially during the winter months, but also the summer months, of course, because there's dangers in terms of health wise then too. But, I think over the years, we've had these conversations about who is homeless and who becomes homeless. And, I was at a soccer game with my kids years and years ago, and I was talking to this person about what they did in Somerville, and they said, well, of course it's a choice. Being homeless is a choice. I mean, those people can get off their butts, and there was other language sprinkled in there. Yeah. Which is, of course, not true. And nobody as a young child thinks, what I'm going to be when I'm grown up? I'm going to be homeless. What contributes to, and two things, I think. When somebody is homeless, when we're trying to work with them in our program, COPE, that sort of helps people who are in the throes of their addiction with harm reduction programs, it really is meeting people where they're at, right? Yep. So, debunk the myth that this is a choice.
Right. No, yeah. I mean, I think if you even think about the history, like what, we didn't have so many homeless organizations in this country in the 60s and 70s. We have always had poverty, but have we really had so many shelters, right? In 1982, there was 2 state-funded shelters in Massachusetts. Now there's hundreds of state shelters. Yeah. So what happened there, right? Yeah. I think one of the things that we saw was that the public hospitals, the mental health institutions, the hospitals across this country, wherever you were living in the late 70s and early 80s, you saw them shut down around you. I grew up outside of Portland, Maine. The one shut down around us. We didn't have a homeless problem in Portland. We have a homeless problem in Portland. So one thing that directly led to it was people that really had a physical disability, had a mental health disability, behavior health in general. Even if they were struggling with substance use or mental health, we did see as we took down those mental health beds and the hospitals needed to be shut down. That was not a great response. But when we built a community-based program, we never thought about that disabled group of people that would need some affordable support, some help, not just the housing support, but also the community-based support. So that's been a safety net issue why the shelters really were established, was some policy stuff. That and also when the feds decided to stop investing in public housing. Right. What we've seen through the years now is, of course, a lot more people struggling with substance use. When we look at the homeless individual, it's very different than when we see a family, right? When we see the family coming to us, it really is about the parents where it's they usually are employed, but their job, the wages can't keep up. Or they have trouble getting to work because of lack of public transportation and those things, or education, workforce training. Asset development is more on the family side. On the individual side, shelters have become that safety net really for our vulnerable population that need a lot of support.
Yeah, and I couldn't agree more. And that you just reminded actually of when I was working in Boston with healthcare for the homeless, and I used to go out with Jim O'Connell, who now, of course, is quite famous because of the
wonderful person.
Yeah, absolutely wonderful person. And I was on the O-van, and it must have been 2:00 in the morning, and I sort of a little punch drunk, I think, from being up all night. And I said to Dr. O'Connor, I said, how many of the people that we're going to see tonight are either, have a severe persistent mental illness and are struggling with addiction? And he looked at me and said, all of them, you idiot. Exactly. And then he sort of laughed, which was nice. Yeah. But that is absolutely right. And I think, even Taunton State Hospital, which is our local state hospital, in 1980 had 2,500 people in it. Now, of course, I think it has 50 people in it. But where did those people go? And you could argue that many of those people ended up incarcerated. Yeah. And incarceration, of course, adds to the social determinants of health in terms of how people are going to do in terms of being housed. And housing, of course, is the most obvious step to transgenerational wealth with families, right? We somewhat take that for granted. My mum is 89 years old, and we have a house in Hull in England. And actually, she called me and she told me, she said, dear, when I sell the house, I'm getting £150,000 for it, and you can share that between all of you, which is nice to think about in the future. Right. Although capital gains tax will take all of that money, but so many people don't have the privilege of having even a small amount of money coming to them. And that's all about housing, right? That's all about having bricks and mortar in the family.
It is. And I do see, like, one of our fastest growing populations over the last 5 or 6 years has been people 60 and over. And really from there, we've lost a lot of rest homes, nursing homes, local groups, local families that used to operate them. And then if a lot of people have retired, they're on fixed income, and if they're elderly, and then they just can't keep up with the inflation. Right. If it's the cost of living or if it's the cost of the rents that are going up, because you're right, they don't have that nest egg or they don't have that house. They're not a homeowner. Right. They've been renting for the majority of their life, and they're just not able to keep up with the rising rents. But what we've seen, especially with our most disabled people, is like supportive housing that like Father Bill's and Mainspring and other organizations have developed can serve the group that used to be in the institutions, and they can be very vibrant communities and neighbors to all of us. They just need a little bit of help with the support. And what we've seen is of that group that we're housing, 93% of them are staying housed more than 3 years. But as you know, if they need to go to the community and get medical or counseling support, having that key, having that apartment where then people can come visit them, visiting nurses, therapy appointments, counseling, all of that keeps them out of an emergency system of care is key.
That's right. The idea of wrapping all those services around, of putting somebody in shelter and then providing their services. And we'll talk about that next week, I know, because that's one of those practices that's working and you have related to that. But, you know, on your website, it said something like nobody should experience homelessness. More and more families coming in. We have this issue in our community of new Americans coming in. And these are people who have the right to live in this country. And they are in need of shelter. The state has made a decision, and I think this is still true, that people have to go on a wait list. How much stress is that putting on additionally, is putting on the system at the moment?
Yeah, I mean, I think that's the recent crisis of having so many families coming in from other parts of the country or other countries and coming here to America has also led to where we already had a lot of people within Massachusetts struggling and on the verge of homelessness for families too. And this is another example of maybe it's been a federal immigration crisis that's been around for a long time. And I think it's not fair because Massachusetts now is trying to do it in a compassionate way. But it's falling into, a migrant crisis is turning into a homeless issue. Right. And again, it's like when the mental health hospitals closed, it became a homeless issue. Why is everything sent to the homeless system, on that side of it? Now, more on a day-to-day piece, you're absolutely right. Like the state, we usually, prior to the last year and a half, we had about 35 homeless family shelter beds, units across the Commonwealth. And through all the years, up and down a little bit because of the environment. But it's over it's 7,500 families now. And it's doubled in just 1 year. So what does that do? What does that do to the municipalities, to the school systems, to the healthcare providers? It really stresses out so many different systems there as we're taking this on. Yeah,
and you know what I really worry about, John, is that it's a wedge issue as well, isn't it? And some of our politicians are not really helping with that. I'm not going to mention any names, but it then becomes an us and them. And you see this all over the world. It's like, why aren't we taking care of our own folks when we haven't really taken care of our own folks for an awful long time, which I think is true. As we think about this, as we think about going forward, in terms of social policy, because your agency is doing an amazing job, and we are working together to try and sort of stem the flow. I sometimes think about the little boy in Holland with his sort of finger in the dike. That there's a big surge coming here. Social policy wise, what should government be doing to address this issue?
Again, I think we have to look at, especially the migrant crisis that's coming into Massachusetts, and say these families can be assets to us. In all honesty, they can be absolute assets. We have so many. I know unemployment right now might be ticking up a little bit, but there's so many opportunities for people to join the workforce. What I can say is, for the past several years, I've seen a lot of the families come in from other countries. They are ready, willing, and able to work tomorrow. Some of that's just policy where we can't get them the work visas, the authorization. So I see an economy that needs this next future workforce, not just now, but in the next 10 years, 15 years. We have these assets. Let's see how we welcome it. Let's galvanize it. And let's welcome everybody.
I love the way that we approach that situation, because sometimes people don't want to make that connection between, who is going to be doing a lot of this work. We have a workforce that is post-COVID less inclined, and I don't know what that's about. And I'm not going to get into generational debate about that. But yes, I mean, I think about that from BAMSI. We have folks who are learning English, who will be multilingual, who will have lived experience, who will be able to provide services that new Americans are going to trust because they look like those people and they sound like those people. And that's a incredibly optimistic way to finish in it. And I believe in that optimism.
And the other piece is to think about it, right, as a wedge issue is like, if I was in the same position those people were, where people are not leaving their country or their community because they want to, they're doing it to save their children. That's something that you and I would do for our children too. They're doing nothing. They're operating exactly like any one of us would do.
Yeah, there's a real commonality there. John, thanks very much. We'll continue this conversation next week.
Thank you.